Hey everyone, I'm Alison Delpercio, the Director of All Children, All Families. I hope you are safe, well, and healthy right now. Like many of you, I am currently social distancing from home in Washington, D.C. My team always tries to be mindful that our participating organizations are managing many competing priorities while they partner with us on their LGBTQ inclusion efforts. And in these uncertain times, we know this is even more true. Thank you for all that you're doing to serve your communities right now. You've been in our thoughts, and we will definitely be keeping in mind the current realities as we work to wrap up our 2020 participation cycle. So much has been put on hold. I know I've had conferences and trainings postponed. One of my favorite activities to do as part of my role is our on-site trainings through our Training of Facilitators program. We were actually slated to do a full 3-day training with our friends in Prince George's County, Maryland this week. And I reached out to them to see if they'd join me in a conversation on how they're adjusting during the time of COVID-19, how LGBTQ inclusion fits in, and how we can all get through this together. And they said yes. So we recorded our conversation so we could share it with you. You may notice a little editing. We had to cut out a barking dog or two in a few moments when our Zoom connections weren't cooperating. But I hope you enjoy the conversation. Maybe you'll learn something, but most importantly, I hope you see and hear yourself in some of their reflections and take some comfort in the ways we're all collectively working to do our best in this time. Let us know what you think in this new kind of virtual world. This is something we might do more somewhat regularly. And again, thanks for tuning in and take care. Hey everyone, I'm joined today by my friends and colleagues at Prince George's County Department of Social Services, the AFFIRM intervention team. They've been participating in the program for years, and we're one of the first organizations to take part in our Training of Facilitators program. We have Harry Morgan, who is the AFFIRM supervisor. We're joined by Lauren, the AFFIRM specialist, and youth ambassador at Prince George's County, Nakiya Lynch. Also want to give a shout out that Nakiya Lynch, they are a youth ambassador with the Human Rights Campaign as well. And if you haven't yet, you should really watch this YouTube video of a speech that they gave at our Time to Thrive conference in February. An amazing speech. Nakiya is a gift to HRC and Prince George's County. So thankful to them and all the advocacy they're doing, and for joining us on today's conversation. So, and thank you, all three of you, for taking the time to chat today. To start off, I just want to do a check-in. How's it going? How are you all adjusting to social distancing? And let's start with you, Harry.
Hi, Alison. Well, it's been a major adjustment, moving to working remotely 100%. Of course, there are a lot of things that we can do in the office, but just learning how to get a lot of things accomplished at home has been a task. And it let's just say it makes me more appreciative of an office environment.
Yeah, I hear you. Nakiya, how's it going for you?
It's going terribly. I am climbing up the walls. I cannot stand it. Oh my gosh, I'm so bored all the time. And like, as someone with a processing disorder, I have ADHD, it's really hard for me to just be restricted so much. And I get so understimulated. And I agree with Ms. Harry. Like, I miss the office so much. I never thought I would miss my desk, my chair, my coworkers. It's terrible. This is too much.
Well, I'm glad we're connecting now, but I hear you. The other thing that we wanted to talk a little bit about is kind of how is LGBTQ inclusion fitting into, or an LGBTQ lens kind of fitting into your response to the current situation, and as we're all adjusting with COVID-19. And All Children, All Families put together a tip sheet with just a few areas of consideration around why thinking about sexual orientation, gender identity expression, supporting clients with diverse SOGI, how that, a few tips around how that plays into our response to COVID-19. And so for start, I just wanted to maybe kick it over to Harry to talk a little bit about why it's important to have an LGBTQ inclusive lens in this time, And we can also kind of pull up a slide that has those 5 key tips in case you want to comment on any of those.
Well, Alison, as you stated earlier, you know that we, the Department of Social Services in Prince George's County, we have been actively working for the past few years to develop our LGBTQ inclusion work, our policies and procedures, and even our training for staff. And so when thinking about how COVID-19 has impacted our organization as a whole, I decided to look at it from an organizational standpoint. We've put a lot of time, money, resources, staff behind developing our LGBTQ inclusion work. And what we don't want is for that work to go out of the door and to, be for naught, because it takes a lot to get an organization up to the level that we've gotten to here in Prince George's County. We've gotten the innovative tier last year for the Human Rights Campaign, All Children, All Families, HRC assessment. And so that means a lot for us to make sure that we're still maintaining a level of excellence in doing our LGBTQ inclusion work. And so when you talk to us about having this conversation about why it's important for to have a SOGI lens, that was the first thing that popped into my mind. I don't want the work that we've done so far to kind of fall to the wayside. I think that this is now the time for what we've learned, the procedures that we put in place, and also for the lessons and the education that we've gotten for our agency and our staff. Now is the time to put that into practice.
So Lauren, can you speak a little bit about what you're hearing from the LGBTQ youth you work with? I know you work directly with a lot of young people in your role as the AFFIRM specialist. What are you hearing from them, and what has it been like adjusting to work and social distancing?
Well, I can tell you for sure, I have never called and emailed so much with my youth. So right now, leaning on, virtual and technological advances to keep us connected is totally crucial, especially since we're talking about youth in care. We're talking about youth that are already more isolated, a little more disconnected potentially because of moving placements and things like that. So keeping community and keeping whatever affirming connections or affirmative networks they have is super important right now. And so I hear a lot of them, talking about making meaningful attempts to stay connected with friends and their peers, especially right now with COVID-19 keeping us also extra isolated.
Yeah. Nakiya, do you want to comment on that at all? Just kind of staying connected with folks and trying to battle some of that isolation?
Honestly, it's been kind of okay, though. We've been very close with each other now, talking about random things. It has been kind of hard, though, because after a while you run out of things to talk about, and it just kind of reminds you that, how important it is to kind of talk to people and check in on them, because even people close to me have serious things going on with the virus affecting the way that they live their lives, and they have immune compromised families, and it's been interesting.
Nakiya, I'd love to hear a little bit more from you too around why is it important for workers, whether frontline or supervisors or administrative staff, to be keeping an LGBTQ inclusive lens as they're working to respond to COVID-19?
Oh yeah, I think it's important that staff keep an LGBTQ inclusive lens, because usually during times like this, it kind of just gets swept under the rug or people forget about it. And I think it's important to show that you are as attentive and inclusive as LGBTQ people as you say that you are when you hire people and when you start these programs, by remaining that exact same way when we deal with things like this. It remind your staff that you actually do care, Also, the organization that fought for the rights of LGBTQ community when the AIDS epidemic was a huge thing in the 80s, ACT UP New York, just posted a controversial picture. It was a quote. It was a picture from the 80s, and the quote said, "If I die of AIDS, lay my body on the step of the CDC." And then they posted something else, and it was a new graphic. It was a mask, and it kind of said something similar, but applied to today's time with the coronavirus, because LGBTQ community is disproportionately affected by the virus, because marginalized people tend not to have as equal opportunity to healthcare. And when you show that you are looking and paying attention to your LGBTQ employees, it reminds them that somebody's looking out for them, because in these trying times, it's good to feel like you're cared for.
I think that what Nakiya was speaking to was specifically around on your fact sheet, like number 2, the unique challenges that LGBTQ youth have, especially those youth in child welfare. And I think that it's really important for when you are thinking about being, looking at your customers, your clients from an LGBTQ lens, to consider those unique challenges. And again, as we stated before, not to throw those considerations out of the door, because the conditions in which our youth live in, or that they're exposed to, these conditions are not alleviated because of COVID. They may in fact be exacerbated. And so it's really important that we look at how we are interacting with our clients and how we're responding to their needs, because we want to improve situations, we want to improve outcomes, not have those, like I said, those services and things that we put in place fall by the wayside, and have those LGBTQ clients be impacted negatively, even more so than what's already happening to the nation as a whole.
Exactly. It's a demonstration of allyship, first and foremost, and it's also a sign that you acknowledge the history behind ignoring LGBTQ identities when epidemics like this happen, and that you don't want to repeat it.
I definitely agree with Harry, too, that this is a time where, if anything, considerations around SOGI, especially for our youth in care, are more important. The department is still having to do the work that it does every day. Youth still have to be placed. We still have a responsibility to make sure that placements for youth are safe and affirming spaces. And so in order to do that, we need for workers and those on the front lines, everyone involved, to still have the same level of dedication that they have when we're not in these, crazy pandemic times.
Well, and I know so many of the folks tuning in and people who partner with us every day around their LGBTQ inclusion efforts are definitely committed to the long-term work around ensuring the best services possible to LGBTQ communities they serve. And so again, that's why we put together this tip sheet, which is 5 kind of simple, straightforward considerations around understanding how COVID impacts LGBTQ communities. HRC released a research brief on this last week that we're linking to. Anticipate some unique challenges to serving LGBTQ clients remotely. One thing we're highlighting is, especially for trans or non-binary clients you're serving, and if kind of social distancing and virtual services requires you to maybe interact with folks in their lives that you don't typically interact with, make sure you're thinking through, how does this young person want me to refer to them in terms of name and pronouns if you're maybe talking to a caregiver versus talking directly to the young person, and just really thinking through those safety and confidentiality considerations that may be posing some unique challenges at this time. Educate, continue to advocate for affirming and culturally responsive services within your partner orgs and referral networks. Connecting LGBTQ folks to virtual community supports. We're providing links to several virtual supports for LGBTQ young people, as well as virtual support for LGBTQ headed families. And then, as Lauren was mentioning, kind of the importance of thinking through SOGI when assessing safety for young people. And so check out the tip sheet for a bit more. And I want to kind of end the conversation thinking a little bit about self-care and hearing from each of you of how have you been taking care of yourself in this kind of this time filled with heightened anxiety, and the importance of all of us bringing as the best we can our full selves to our work while also navigating this uncertain time.
I've been just kind of detaching myself from, I think, the intrinsic ways that capitalism kind of affects our need to be productive all the time and to do things all the time. So I've just been letting myself be lazy. I've been eat whatever I feel like. I've been up watching Disney movies. I've just been having a good time.
Nice. How about you, Lauren?
Self-care, really, I'm just taking it a day at a time, trying to, control the things I can and, you know, keep myself informed. Like Harry said, try not to be too obsessive with the news because it can be overwhelming. Definitely been leaning on family more and technology. I can say I've been in contact with family and even friends who we hadn't spoken in weeks. So, you know, if anything, it's kicking people into gear to stay more connected.
Yeah. Well, good. Well, any kind of closing thoughts for your colleagues or peers listening in before we wrap up?
I would just like to say that I think that it's really important. We talk about this in the ACAF trainings and the All Children, All Families training. That this is now the time to really take note of how important that language matters is. That's what we talk about in the training a lot. And so we don't have the option right now of physical touch or of a nice nod or a warm expression. So when we're reaching out to our LGBTQ clients, our colleagues and other customers and families, be very mindful of your language. This is the time to practice those affirming statements and those validating statements, because that may be the only affirming or validating thing that youth or that person may have gotten that day. And so as we look at how COVID-19 may be getting increasingly worse, be mindful of the language that we use, that we're being SOGI inclusive and SOGI competent and cultural humility, all of those things that you talk about, Alison, in our trainings, that we're practicing those things because it's really important to the safety of our clients and to, you know, their mental health right now, because, you know, as we talked about, the governor made an announcement this morning of kind of a shelter in place at 8 p.m. today. The limited kind of physical access we have to people, it may increase. So language matters. Be creative, be validating, be affirming. I know we say all of these things all the time, but this is the time to put that into practice.
Well, that's great. Thank you so much, Harry. And, you know, thank you all for taking the time to chat. It was really good to connect with each of you, and sending you love virtually, and excited once we can to reschedule our training and to do that great work together. And I'm sure I'll be talking to each of you soon. Thank you.
Bye, Alison.
Bye.
Hey, everyone. Thanks so much for tuning in. I hope you enjoyed the conversation with Lauren, Harry, and Nakiya. One last note, I just wanted to make sure that you saw on the slide there at the end that we are currently waiving the fees associated with continuing education credits available through our webinar series. Recognizing that so many learning opportunities like conferences and trainings have been postponed or canceled right now, we wanted to make our continuing education credit through our webinars as accessible as possible. So please take advantage of our webinars, and you can use this code HRCACAF0410, and that will waive the fee associated with our continuing education credits. When it asks for payment, you can just enter that code there. And thanks again for tuning in. I hope that you're well, and we'll talk to you soon.